Hi, I'm Ken Cutbush. I'm an orthopaedic shoulder surgeon working in Brisbane. I'm going to talk to you about the risk and potential complications of a distal bicep tendon repair. So this is when someone ruptures the biceps at the elbow and it needs to be repaired. An example of that is this here. So this is an MRI scan. The elbow is here, the wrist and forearm is down this way, shoulder is up this way. And this is actually the tendon of the biceps. This is hematoma here. That's the tendon of biceps. That's sort of curled up there. That should be all the way down here, connected to the radius. You've got two bones in the forearm, the biceps connects to the radius. This is the biceps actually retrieved through an incision up here in the arm, and then it's pulled out, trimmed up, all the scar tissue is removed, pulled out to length, then it's whip stitched, a metal button on the end, a little endo button, and he says it's got sutures that will help pull that through the bone, and then they're removed. This is what stays in here, that construct. And you can see here, the final construct, the tendon is out to length and connected up to the bicep tendon. Now, when I'm talking to patients about this operation, what I mentioned is that there's risk of infection. Anytime we do an operation, there's a risk, and it probably runs around 1% for an open distal bicep tendon reconstruction. There are a lot of nerves going through the elbow, and those nerves are at risk and can be injured or upset when doing the operation. The biceps can rupture. This is an extremely strong construct. Other constructs can risk the bicep tendon rupturing. And you've got an anesthetic as well. There's a particular complication with the elbow, which is heterotopic bone ossification. When new bone is formed around the elbow, it's quite a weird little complication. The bone forms in the muscle adjacent to the elbow. It's particular to elbow operations. It can happen anywhere, but elbow is somewhere it's noted to happen. Now let's put some science behind that. There are two papers I'd like to look at. Surya in American Journal of Sports Medicine 2020 and Ford et al. Journal of Shoulder and Elbow Surgery 2018. So the Ford paper, they looked at 970 distal bicep tendon repairs, and the Surya paper was a systematic review. They looked at 72 previous publications related to complications of distal bicep tendon ruptures and fixing them with 3,080 patients. So that's this one here. What do they find? Well, complication rate varied from 25% to 7.5%. You see here Ford talk about 7.5% major complications, whereas Surya talking about a 25% overall complication rate. And these can be little irritations and wound problems and so on. So this is not an operation that you would undertake unless you really needed to have it done. Major complications in the Surya paper was 4.6%. Re-rupture, that is 1.4, 1.5. So 2 patients every 300 re-ruptured. Nerve injury, that is something you really do need to think of. The posterior interosseous nerve is the most significant one. That's a motor nerve. If that's injured, you can't lift your wrist up, you can't lift your fingers up, so it hangs like that, and that will need to be fixed. The lateral antebrachial cutaneous nerve of the forearm and the superficial radial nerve, both of these are sensory nerves. It's not such a big deal if there's a problem with them. You get a little patch of numbness or disordered sensation. But that's and normally these sort of things will be temporary and recover. Infection rate between 0.5% and 1.4%. Radial fracture, that'll be pretty unusual, but you can, because we're drilling into the radius to fix the tendon there, it's possible to break it. Chronic regional pain syndrome occurred in 0.1% and 0.6% respectively. And this heterotopic ossification that I mentioned, 4% in the 2020 paper, and less than that in the 2018 paper. And that's quite a significant complication of this operation, which is idiosyncratic to it and difficult to prevent. I will normally give patients indomethacin for 6 weeks post-operatively to reduce that rate. If you'd like to look at this further and look at these papers in detail, if you scan that QR code, it will take you directly to that scientific publication. So that's a rundown of the risks and potential complications of a distal bicep tendon repair. Thank you for listening.